In the world of medicine, artificial intelligence, AI, is becoming more pronounced and promising every day. One's abilities in data analysis, diagnosis, treatment, and even drug development open up new horizons for medical practice. However, will AI exceed human expertise in medicine, or is it mainly a tool to support healthcare professionals? Can AI be life-threatening? How much can we trust him?
Hello everyone and welcome to the Health Tech Revolution podcast. My name is Dilna Sturdebekova and today we will discuss about AI in health. My guest today is the Astana IT University student Anisa Sarsimbayeva. So thank you for joining us today. Would you introduce yourself a little bit further?
Sure, it's a pleasure to be here. In fact, medicine and technology are inseparable now, especially artificial intelligence, and I have long wanted to discuss this topic with you because it's very relevant today.
Well, I'm glad to hear that. So let's start our discussion. I see that you understand the integration of AI and other modern technologies in medicine, but in your opinion, how effective is the use of AI in medicine nowadays?
In my judgment, AI is very effective. I recently read a study where the doctors from Portugal were interviewed and their attitude to the integration of AI into medicine, and their AI is seen as a valuable tool for medical professionals, offering benefits such as improved access to medical data, increased accuracy, reducing the number of errors, and freeing doctors from routine tests, and thereby improving the quality of medical care.
Yeah, I agree with you. It's an exciting time for the intersection of technology and medicine with the potential to revolutionize patient and care. But I heard something about replacing doctors to AI in healthcare, and I guess that this is quite possible since AI has already gained enough trust in people and it has already made great strides in medicine. So, how do you think artificial intelligence will replace doctors in healthcare?
Well, in my point of view, it is expected that artificial intelligence will not replace doctors, but rather serve an auxiliary tool for improving patient management. And it can also help from technical side and become support for doctors and medics.
But I have read several studies where it is most often said that doctors and elderly people do not agree with the use of AI in medicine. For example, this article called Artificial Intelligence in Medicine Today and Tomorrow clearly states how uncomfortable it is for doctors and elderly people to use AI, and sometimes AI shows some difficulties in constantly testing tools. I believe that older people have difficulties with modern technologies and prefer traditional treatment more, and experienced doctors may not trust artificial intelligence. So, how do you think older people and senior doctors will react to artificial intelligence?
The study I mentioned earlier also said that experienced doctors, especially surgeons, are positive about integration artificial intelligence into their medicine, into their practice, since artificial intelligence is able to isolate hidden medical informations in large databases to help in making clinical decisions, which can help reduce the number of erroneous diagnoses inevitable in human practice. In addition, the use of artificial intelligence in clinical practice can significantly reduce the burden of routine work, freeing up more time for patient care.
Okay, so let's imagine, that AI has been integrated into medicine, and medicine and all its components will change a lot. But how much will it cost to the government? For example, how much will the surgery cost? Will an ordinary average citizen be able to afford it?
Yes, if you look from this side, it will cost to the government very expensive. Investments in AI software platforms that provides tools, technologies, and services will be somewhere of the range $2.5 billion per year For example, there is a Da Vinci robot, which is a device for performing surgical operations. It consists of two blocks. The first is intended for the surgeon operator, and the second one is a four-armed robot. A manipulator is an executive device, and its cost from $2 million.
Well, I think we should be nearing to the end. So I want to ask you, what advice can you offer to listeners who are interested in using artificial intelligence in their own healthcare?
My advice is to be informed, explore what technologies are available and how they can be useful to you. But also remember that AI does not replace doctors. It is a tool that helps them make more informed decisions.
Very well said. Thank you for agreeing to make a podcast with me and discussing some important topic.
Thank you for that interesting experience.